So what I'm going to talk about today is heart health, something very dear to my heart, and uh, I'll explain why I think we need to know more about heart health. Start at the top would be good, Sam. Right. So I do have to put the preface in that this doesn't negate the need for professional consultation, because people will jump on here as the time ticks on, and you do need to marry the information that's relevant to you. So, but what I do want to talk about are the key actions that will help protect your heart, which is this beautiful muscle. I want to talk about the foods that you can eat, the exercises, and very importantly, when to recognize that things are going amiss with your heart and how to seek or when to seek help. At the end, I do have a big surprise. So this is my background in doing interviews. I'm considered a specialist in hormones, but I was and very proud of my training in coronary care. I love hearts. I love the way they work, and I love discovering more about the cardiac system because it's it's not finite. I think as time goes on, we understand more and more it's our emotional center. When people say I love you, they're actually not saying I love you with my head. They're actually saying I love you with my heart. So yeah, hearts for me offer a lot of solutions. When we draw the I love you, we use a heart. So yeah, I love the heart. Those who aren't familiar, got 9 published books, 3 now are bestsellers. Formerly trained. I am a nurse. I've always been a nurse till the day I die, even if I'm registered or not, but trained in coronary care, which is specific around heart care. And I did work in pharmaceuticals for 8.5 years, and my specialty drugs were cholesterol-lowering medication. So I got to go to a lot of conferences around the world on antihypertensives, on cholesterol, but mainly cardiac conferences, which were fantastic. And just, I've got 3 kids and a cute dog called Honey. And I do love hearts. Even this morning when I went for a walk along the beach, there was a leaf that was being washed out and it took on the formation of a heart. I see hearts everywhere. It's been a life passion of mine, and I suspect it will stay with me to the day I die. So heart disease is really prevalent. And one Australian dies of heart disease every 12 minutes. So that's 5 an hour, which is quite a lot. Now, this data is from 2019. 21,000 women died from cardiovascular disease, and that's the equivalent of 1 in 4 female deaths. So it's quite a high number. Now, I'll be covering a range of things today about hearts, but these sort of numbers, not all of them are, considered elderly women by any stretch of the imagination. But in 2020 to 2021, hospitalisation from cardiovascular disease, which is what CVD, as a principal diagnosis, was 1.6 times higher for males than females, and that's normal. We know that men don't have the same protective mechanisms that women have in place, but after menopause, women and men start panning out that it's equal. So it's unusual that a woman pre-menopausally dies from heart disease, but certainly by the age of 60, the risk factors, or not the risk factors, the probability is the same. So in 2021, there were 600,000 hospitalizations where cardiovascular disease, that's it's 2/3 of a million, where cardiovascular disease was recorded as the primary diagnosis. It accounts for 5.1% of all hospitalizations. A bit frustrating for me. I do think it's one of the most preventable, and it's often called the most preventable disease that people experience. Yet the allocation of funds don't go that way, or certainly unfortunately, I think there's not enough emphasis on lifestyle and understanding and educating people what the heart's all about and the blood vessels and the valves. But there are other things as well which affect the heart, viruses, disease, which aren't necessarily preventable, mechanical issues, where you might blow a valve, not necessarily preventable. So there's certainly plenty of congenital heart disease, also not preventable. So there are things that are not preventable. I understand that, but there is a lot that is. So this is your heart. If you close your fist now and look at your hand closed, and usually just use your left hand to do this, and place that just under your left breast. That is where and how large your heart is generally, and that's where it sits. So these were just some, all causes, coronary artery disease. It was the number one cause of primary diagnosis, and it just kind of tabs off there of what the different things were: stroke, atrial fibrillation, heart failure, myopathies, peripheral vascular disease, congenital heart disease, small, but, still significant. And then, as you can see by age, it generally isn't what we would consider, in emergency when I worked there, we used to say that, particularly with heart failure, it was a wearing down of the muscle. But it doesn't need to be that way. But certainly it's not unheard of for people to die, or men to die, so the men are in blue, to die in their 40s from heart disease. I actually personally know, 1, 2, 3, and this was pre-jab, so they died from heart disease. But it really starts jumping up. You can see there, it almost doubles there, and then a lot 85 years and older. Women have a slower incline because we've got protection from estrogen until menopause, and then those estrogen protections that we have start whittling away if we don't look after ourselves and take certain things. So they're just some little links I put there. Well, I had them to watch. Let's see if this works. Let's not. So the cardiovascular system, which cardio refers to heart, vascular, the blood vessels, and that includes your arteries and your capillaries and your veins, pumps the blood around your body. It carries oxygen, but it also has this very important role of bringing back the waste from cellular metabolism. And that can be all toxic matter, yucky matter. It then takes it to the filter systems of the body, the kidneys, the liver, the skin, where all the yucky stuff is dispensed, and even our lungs can be seen as a detoxing station where we blow off the carbon dioxide, reoxygenate the blood with oxygen to carry it back around. Now, without that system pumping along, we only really last a few minutes. So it's very important that we have blood pumping through that system continually in order to sustain life. This is called an ECG, or a electrocardiogram. And an ECG is really an electrical look at the conduction through the heart. So if you imagine it's a muscle like that picture before, what we do with an ECG is we place markers around the chest of the person and their hands and their feet, and we read the electrical activity through that muscle, because it's just a muscle. So we measure whether waves are coming towards where we're standing as a meter, or away. If it's coming towards, we get an inflection up. If it's moving away, we get inflection down. And we can tell, I can read ECGs better than I can read Mandarin, that's for sure, but as well as I can read the English language. I'm very well trained in this. I can tell you exactly what was going on in this person's ECG based on their electrical conductivity. So it's a really handy tool. Excuse me. With unexpected or sudden heart issues, the first thing people should be doing is getting to a point of safety, calling out for help, and when you're in medical attention, is getting an ECG and oxygen. And if there's pain associated with pain relief. Now, there's a lot of things that impact on heart health, and this isn't exhaustive, but infections. So a lot of rheumatic fever is actually an infection that used to affect the valves. So valves of the heart can be infected. They can grow little bits of fragment on them and become ineffective. Viruses can attack the heart, like they can attack any muscle. Parasites can also do the same thing. Inflammation of the heart. So myocarditis, pericarditis, pericardium is the sac around the heart. It can get inflamed, and that's incredibly painful and also quite dangerous. But it's like having a swollen ankle, but it's around your heart, and there's a lot of nerve conduction, so it's incredibly painful. And anything with itis on the end means inflammation of. So myocarditis you might have heard of. Myo means heart, cardio, we've already talked about the heart. So myo's muscle, cardio, cardiac, muscle tissue inflamed. Myocarditis, pericarditis, pericardium inflamed. Cholesterol, high blood pressure, and stress really can impact on the heart. Doesn't like it at all. There can be trauma, like a car accident where the steering wheel hits the chest and can cause bruising on the heart, or even sternal fracturing, rupturing, things with the lungs that put pressure around the heart, and mechanical issues such as valves blowing, aortas, aortic aneurysms, things like that. And we get drug-induced issues. So many drugs have side effects that affect the heart, and unfortunately aren't often thought of in the first instance, and people will go on with these fatigue syndromes. They just haven't got energy, and it's because the heart is being suppressed by a drug, and it's an adverse reaction. And certainly emotions. I was saying before about the heart, we don't say I think you when we say I love you. We say, we feel it from our heart. I love you. And we make a symbol with our hands that is like the heart. We feel our emotions from the heart, no other part in the body, but from our heart. It's our emotional center. Which is why people can get a broken heart and get severe chest pain. For Tay-Sachs syndrome, PTSD, they used to call it soldier's heart, but we know the heart plays a massive role with emotions. So how do you know your heart's starting to wax and wane? Well, you can get high blood pressure when it starts to fail. Swollen ankles is a really indicative signal, especially if it's on both ankles, that your heart's not keeping up pumping all the excess fluid back out of your body. You can get ECG changes. That was that pretty graph I showed you before. And there's lots of changes that can occur along that we can pick up there. Blood tests will tell us if you've got enzyme rises. MRIs, CAT scans we use nowadays for pericarditis, myocarditis, echocardiograms, stress echoes, and Holter monitors. So these are things that your doctor can order, and I quite regularly send patients back to their GP to get some basic cardiac measuring, because it's really important. And I can't really order that stuff, but I know how important it is for diagnostics to get this bit right. Plus, there are other signs like looking at your hands or your lips. If they get cold or start going blue or purple, that means that you might not be able to pump all the blood to the extremities. And we start seeing that with people with advanced heart disease, but also in acute, which means short-term heart disease. So these are some of the ECG changes. This person's had a heart attack. You can see I won't go into it too far, but this is called the STQRST, and there's elevation. So that should come back to a baseline. It hasn't. So this person's had an anterior infarct or a heart attack that's affected V2, V3, V5, which is the front of the heart. So they've had probably a left anterior descending heart attack. And we could talk about things like flipped T waves, which this person has. They've got flipped P waves as well, which is interesting, but that's V1, can happen. So this person would have been in a world of strife and hopefully they got the intervention they needed. If someone is having a heart attack or is going these are typical changes. They get pain and they tell you that they feel like an elephant has sat on their chest or a truck has driven on their chest, and they really they can't give you any energy because they're struggling to breathe. They're struggling to fight down the pain. Now, they can, and very often, I've been with many people as they've had a heart attack in emergency or just after, like hundreds. They had this distinct feeling that things aren't right. They know. If it's an inferior heart attack, so if the base part of the heart's being affected, they might feel nauseated, they'll get white, they look clammy, sweaty, they look like they're about to vomit or pass out, but they'll go, I've got pain, and you know they're having an inferior infarct or heart attack, sorry. Fatigue, they might have a cough because they might be going into a bit of failure. Throat pain, arm pain, shoulder blade pain, that should say, not blad, shoulder blade pain. So any pain that can start in the chest, go up to the throat, come down to the arm, can be between the back of the shoulders and the shoulder blades. But I've had plenty of patients in my time, particularly women, they might just get like a sore wrist or an arm pain or throat. I had this lady once and I triaged her, and it's just, you know, this is that nurse instinct you have. Triage is when you present to emergency, and she walked in, she was a cleaner, and she'd had chest pain for 5 days. She hadn't, sorry, no chest pain. She'd had throat pain for 5 days, and that was it. She said, but I don't feel good. You know, she was, when I worked in Melbourne, it was high ethnic. She goes, I don't feel very good. And I just had this feeling that wasn't right. I thought, she's got throat pain and she's coming to emergency. She's not telling me she's got a sore throat. It's not infected. And I triaged her highly, and I got her straight in. We put her on a monitor, and sure enough, she'd had a heart attack 5 days earlier. And she just put up with it because she needed the money as a cleaner. So it can manifest in all sorts of ways, and women particularly manifest in different ways. Or you might get irregular heartbeats, particularly if the heart isn't getting enough oxygen, it will start skipping beats, and that can go to just irregular, like boom, 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 boom. Can slow down, boom, 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 boom. Or it can fasten up, boom, 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 boom. Or it can go, that's can fibrillate, which means it just starts shaking, boom, 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 and you can feel that in your chest. So they're called ectopic beats, and they feel very strong, or they can feel very disconcerting if you've flipped this into a ventricular beat or a supraventricular beat, which is the top part of the heart. But it can feel like a butterfly. It's awful feeling. So we've got our man. That's very typical. I think he's maybe not as expressive, but you know, typically people grab their chests. I had some bruised ribs, maybe fractured ribs 2 months ago, and I remember I was at the markets and I did this posture because I just went, oh my God, and I grabbed my heart. And these 2 people came in and they were like, are you okay? I said, oh my goodness, this is exactly what a heart attack looks like. You get stopped in your tracks and it hurts. But if you're a woman, remember, it might just be shoulder blade pain, might just be jaw pain, it might not be classic over your chest. Normal heart, this is pericarditis. I talked before about the myocarditis is when myo being muscle of the heart getting inflamed. Pericarditis is the sac. It also hurts a lot. And there's a reason why I'm mentioning this. We're seeing more pericarditis and myocarditis than we've ever seen before. And it was well documented that the COVID vaccines were going to do that. And that is exactly what we're seeing now coming through. And unfortunately, it's affecting young men primarily, but young girls are getting it too. So myocarditis, myo meaning muscle, carditis of the heart. So it gets inflamed, very sore. It hurts. And people are going, unfortunately, to emergency departments being told they've got anxiety and spun away. Well, here, go home, have some Nurofen. Or worse still, myocarditis, it's really mild. Don't worry about it. Just have some Nurofen for 6 weeks. It should go. There's nothing not serious about having inflamed heart muscle or inflamed pericardium. It is serious. Now we'll talk about blockages. Blockages, there's this misconception that blockages happen quickly. What tends to happen is we end up with an inflamed, it's called the intimal lining, the inside of the arteries that around the heart. And cholesterol, which is a fatty byproduct from our food, does get deposited in the lining, but it tends to expand out first, and then we'll start to lean in to what we call the lumen, or the passageway here, and it will start to shrink it so it's not as wide. But generally what we know happens in 80% of heart attacks is it happens on what we call a bifurcation. So it'll happen where an artery starts to, go around a corner, and the person will have a stress event. And then what happens is it splits and leaks. And that little splittage stuff creates platelet aggregation. So platelets in your bloodstream want to cause a clot, and it'll go to that sticky matter, and then it passes further down the heart, and you end up with a heart attack. How they open that up is they put a stent in. So they'll do it through your leg or your arm, and it's called a femoral stent or an arterial approach. And they'll put, it's meant to be a neutral mineral titanium stent in there, and they put it in very thin, and then they expand it and keep it open, and it will stay there long term. Or they'll just do an angioplasty, which are done less nowadays, but angioplasties are similar, where they go in and they put what's called a balloon and push the matter back out, and it should stay stuck there to open the passageway through again. Cardiac arrhythmias. I was just talking before about normal heart. When we measure it, the heartbeat starts up the top in the sinoatrial node, goes down to that next little green marker, the AV node, and then it follows these express pathways down the ventricles, and it causes a contraction back up to the top. That should be, the SA node should go about 60 beats a minute. Sometimes atrial fibrillation is that when the atrium start to flutter or beat, and they can do it regularly or they can do it irregularly. And atrial, that's where the AF comes from. And they can ping, 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 ping. Because they're not from the SA node, they can be differing in strength. And so when you do an ECG, they can look all kind of higgledy-piggledy. Or if it's atrial flutter, it'll be coming from one particular spot, because every part of the heart's so amazing. Every cell in the heart has the capacity to carry its own beat. It's just amazing. But if one does it consistently due to drug induction or hypoxia, which means low oxygen, or a virus, it'll ping, 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 but it won't be going through the normal pathway. And that's called atrial flutter. So the atrium at the top here, and the ventricles, as I mentioned, are the big pumping part of the body. Heart attack generally happens in the ventricles. It's not great wherever it happens, but because it's the main pump of the body, when you've got a problem in that muscle, the ventricular muscles, there's a problem. And definitely more so on the left side than the right, because it's the main pump. Before I was talking about the, this looks like, this could just be an SVT with a bundle branch block, which I won't go into, or it could be ventricular tachycardia, but I think it's the former. And you can see they're very rapid, boom, 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 tachycardia. So this might have been going at 200 beats a minute, which is very fast, and the heart gets exhausted. It's just a muscle. Starts getting lactic acid, it starts developing pain, and it starts not wanting to do it. So let's talk about some preventative things you can do. Food, exercise, and pre-testing is critical. So I love this picture because it's in the shape of a heart, but it also kind of lends itself to the fact we do have to eat a variety of different things, and all these vegetables were given to us by Mother Nature, and they have so many cardioprotective elements within them. Antioxidants, purple things, beetroots, radicchio, resveratrol, and red grapes, and Pinot Noirs, and broccoli, and all your greens there with the phyto protections, and your yellows going through to your oranges and your reds. These things help protect your heart. Very important as well to consider omega-3s, which are good fats. Now, omega-3s, there's about 23 different fats, but then there's two essential fatty acids, EPA and DHA. We cannot make them from other fats, so we have to eat them. So they're the things like your deep sea fish, or your avocado, or your flax seeds. Nuts and seeds are high in omega-3s. Avocado, I said avocado. Your heart also needs iron and magnesium and calcium and potassium and lots of other things. A lot of people will get low in magnesium, and it's difficult to get in soils, particularly in Australia where I am, because the way they've cultivated the soil, or haven't looked after the soil really. So if someone comes to me with a heart thing, I'm always looking at how much magnesium are they having. The hair test is good. Serum levels for testing, like blood tests for magnesium, a bit wishy-washy because magnesium lives inside the cells. So the hair test is a better measurement for that. But if anyone's got any fast heart rate or any ectopics, magnesium's the first place I go. Sometimes iron, if it's a young girl who I think's also got iron deficiency. And water, lo and behold, that are good stuff. We can reduce stimulants because the heart is a muscle. If you're having lots of coffee, it will respond and be stimulated. We don't want that. Other stimulants are glutamates, so MSG. There are other chemicals in foods that also get converted to glutamates, not great. And stimulants like drugs, no-dose, pseudoephedrine, things like that, are not great on the heart. I'm not a fan of white carbs. I won't go into that there. Reduced trans fatty acids. So they're margarines. Trans fatty acids are normal fats that have been manipulated so that they start to twist, and they don't really respond like normal fats do. They're quite dangerous. Sticky, clotty, yucky. Do not have margarine. And there is a red meat debate. Should you have red meat? Shouldn't you have red meat? I think it depends on the individual. Pritikin was a genius at diets, and he showed that eating red meat was not good for your heart. And by getting rid of it, you help your heart health. And then there's a lot of other debates that show that eating only red meat and not phytates and things on vegetables decreases inflammation, protects your heart. So for me, the jury's out. I think it's very individual. So how do you know? How do you measure what's going on in your heart? I think you need to do a hair test and see if you're missing some of the key elements. It also picks up, like it did on this one here, cardiovascular system needed help, cellular hydration, energy. It's a 37-page report based on your hair sample, and you get to post it in from home and send it to me, and I'll send the report out. I'll show you where you can get it shortly, or you can do it with a consultation as well. Goes into foods to miss EMFs. If you've got parasites on board, it's fantastic. You should do it probably I do mine every 4 months, but at least every 6, because things change. Exercise, this is really what's happened with a lot of Australians. We've gone from being lean machines, working in the fields, to sedentary. I've got to talk after this on menopause. I've already had one this morning on fat tummies and how to flatten it. Cortisol and stress. We put on weight. Super important that we keep our weight at a healthy range. And most people know what it is. But accepting that size 16 or 18 is the new normal is not a healthy approach to our community. We were designed to be active. We were designed to move, squat down, medium things, reach up, walk for distances, use our muscles. We were designed to do it. And the heart is a muscle. It needs exercise. It loves exercise. If you're familiar with my work, I really believe that stress is one of the greatest killers. We need to reduce it. We need to do it before we burnt out. Downshift, do more fun stuff, get out and about. Meditation's great for that. Exercise is great for that. Community support groups are great for that. Volunteering is great for the heart. And choosing yourself before you help others is imperative. Got to look after ourselves first and foremost. So the hair test I was showing before, it can indicate whether someone might be low in magnesium or calcium or iron or CoQ10, the antioxidants, the phenols. So it's fantastic. On your hair, we can tell what your body's absorbed over the last 3 months, and it's fantastic. I love it. Hormone test is also really helpful. Can tell us what's happening with your stress hormones. Like in this person, you can see their cortisol's too high, That's unhealthy. When you get this data, it validates you, but it also gives you direction of what you need to change, how, when, and quickly, and all that sort of thing. And then there's blood testing you can do, like homocysteine, ApoA. Homocysteine is a very important one. I get my patients to get tested, and you'll probably have to request it off your doctor. But homocysteine is a very good indicator of and predictor of heart health, and pretty easily managed. You just put the person on folic acid, and they might need activated folic acid, but that's the way you bring homocysteine down. Another hormone test there, you can see the cortisol is way too high. And the testosterone is pretty low. So if you do want to do a heart tune-up, I'd have the two together, the hair test and the hormone test together. It's $997, and you can order that from my website. Now, I will quickly jump out of here and just show you on my website where that is, where you order it from. So you just go over to my website, sambopatrick.com, and here under tests, it's just under there, hormone and hair testing. Now, if you just want to do a hair test, you can order that. But if you want a consultation as well, you would order the hair test plus consult, and then we get to chat about your hair test result. But I'll also, if you have got a heart thing or you want to run some blood tests, you can do it in that consultation and hair test. Or if you want to do the hair test and hormone testing, it includes a 60-minute session with me, or you might just want to check your hormones. So that's where the testing is on my website, and you just go to sambopatrick.com. And I hope that you've really enjoyed that presentation. And I think together we can do a lot of change. I know people want me to talk about supplements to help here, and particularly with the recent vaccine rollout. But I'm a bit reticent too, because I think that is worthy of a consultation. And it is so individual. And I am getting a lot of people who are taking so many things, and they possibly don't need to take NAC and CoQ10 and Quercetin and all these things. So that's why I'm a big fan of just doing those tests, having a consult and seeing what we need to do. So I hope that helped. And I look forward to catching up with you maybe on the next webinar or somewhere else soon. All right. See you later, everyone. Bye-bye.